right, I think we're live.
Good morning, everyone. Thank you so much for joining us.
I'm Valere Ziske. I'm the nurse practitioner here at Lifescape Premier.
And I'm Dana Bosselman, functional dietitian.
And we're going to be doing kind of our live Friday question and answer sessions for you. We've got a few pre-posted questions that we can kind of go over and discuss, and feel free if anybody wants to type in some questions and we'll go over those as well. Let's see here, I have multiple. So one of the first ones that they were talking about and that we received was, is it safe to get my nails or my hair done? And I believe today was the day that Arizona said that they could start with letting appointments come in and doing those as long as there was under some certain sanitary stipulations. It's a tough question, I think, for the most part. I think you need to ask and find out if your nail salon or your hairstylist is able to provide the hand sanitizer, face masks, if they're wearing them, if you need to wear them as well during the appointments, and finding out, are they disinfecting their stations in between clients, and finding out if you need to be waiting in your car to be called in to the establishment, or do they have that kind of safe social distancing in any of their waiting areas or anything like that. So that one it's really, looking into it, researching and talking with your establishment and finding out what their protocols are, because not all of them are opening. Especially because they too are struggling to get their personal protective equipment as well, and their sanitation supplies.
I can just read you the
Sure.
questions.
That'll
I'm
work.
going to assist Valerie with my goggles on.
Mine too.
How should you go about feeling safe when eating out at a restaurant?
That, I know the restaurants are really trying to make their plans and preparations on how to do this. Again, they have to be able to have that social distance in between tables. I think for people that want to go out to eat, it's making sure, are you sick? Is anybody in the party that you're with having any type of respiratory symptoms? If they are, you shouldn't be going out to eat. If there's outdoor seating, that would be, I think a better option rather than sitting inside, just because we know that outdoor air, we're getting more of that kind of dilution of any potential virus particles. However, Arizona, it is getting quite hot, so we're not quite able to sit outside as comfortably as we once were. As well, most of the restaurants should be implementing some way that the people cannot be in line, or in the little front entrance way with the hosts congregated together. I don't know how individually each establishment's going to do that, whether they take your cell phone and number and call you when a table is ready. I know that there was some discussions of disposable utensils and dishware. I don't know how feasible that is in many restaurant establishments. I had heard from one local restaurant that was being interviewed on the news the other day that they said to expect not to have your silverware and glassware sitting out on the tables, that it would be brought out to you. And I believe all the hostesses, waiters, wait staff, cook staff, everybody in the establishment should be wearing masks. And I think that was going to be kind of across the line guidelines that they were going to do.
Okay. And what if I'm thinking about traveling during the summer, maybe late summer? Will it be safe? Should I cancel and postpone?
That's a really tough question, because as individual states are relaxing their social distancing guidelines and trying to kind of return back to normal, we will be seeing a surge and an increase in cases. Current guidelines are recommending to avoid any unnecessary travel at this time. So if people have to travel for business, that's something that they have to do. This might be one of those summers where maybe taking, a drive and going to, your state national parks, camping, or areas like that. The hard part is we just don't know what each city is going to be like as far as what their current levels of cases are, and then what state, because we're going to slowly see this little influx kind of going into certain states, and other states might still be kind of bordering, or ideally, if like on the East Coast, not too many people are choosing to travel there, obviously, right now. So they're, potentially going to have more of a downward trend. But overall, we do know that in the U.S., regardless of social distancing, current social distancing measures and kind of, shutdowns, in even relaxed social distancing guidelines and the current state, we will be seeing an influx in the cases.
Okay. How do you recommend handling when someone sees a situation where other people are not complying with the social distancing recommendations and or refusing to wear masks?
So I think, in that situation, if you're in, going for a walk outside and somebody's coming up behind you or next to you or too close, I tell my kids, even my kids and everybody, you can say, hey, I'm trying to do my civil duty of social distancing, could you please, move a little bit to your left or right, or if you can just kind of physically start to move a little bit more. If it's visitors coming over or people, at a job, or one of your place of employment, asking them and telling them, hey, this is what we should all be doing. It's not just about us, it's about everybody as a whole. And to please follow through with that. I would like to think that companies would be providing people with guidelines as to in their offices, what they should be doing to stay as healthy as possible and to avoid any potential exposures to anybody.
Okay, thank you. This is kind of another tough question. It seems that, sorry, I'm trying to do this without. Okay. News seems to be so polarized and truth harder to discern. Where can I get more balanced information?
There's some websites with charts that kind of show where in the news spectrum as far as bias goes. The site, I believe, is at All Sides. They show where's all the way off to the left, all the way off to the right, and which media outlets are more centralized in providing the most unbiased as possible news information. I think you can't just look to one physical news outlet as the only source of information. I think we all have to be open to seeing what both ends of the spectrum are saying, but also know, okay, which sites, I think like NPR, BBC, is it USA Today, Wall Street Journal, those ones are more of a centralized, the most unbiased that they can be news outlets, but we can take into account all, what each side is saying, but know that we need to know that somewhere in the middle there's going to be the most unpoliticized, unbiased as possible sources for us.
Absolutely. Can you review some of the steps that Lifescape is taking to protect our patients as they come in for their annual physicals and updates?
Yes, so this is an ever-changing, as we have all grown to learn how to be more adaptable to daily changes and everything. So our office is working with our patients. For those that are high risk, we have been having them hold off coming into the office unless they absolutely needed to be. For future, we are working on having patients potentially stay in their cars and being called on their cell phones when they can be brought in, and then immediately having the medical assistants bring them into their exam rooms so they're not having to stay in the waiting room. We're working on making sure that our waiting room has nobody sitting, and congregating and not keeping that 6 feet social distancing guidelines. So we might have to do some rearranging in our front office, but we'll see how that works. Everybody, except for me right now, I know, I'm sorry, is wearing face masks in the office. Front staff, back staff, everybody's wearing that. We're doing daily disinfecting of everything, typically before we start seeing patients. After, the last patient's going, we have designated rooms where we bring our sick patients to that have, I think, HEPA air purifiers in them as well. We're wearing our PPE whenever we're having to see one of those sick patients. The patients that have any respiratory symptoms or could potentially be in one of the symptom spectrum of COVID, we're having them call the office when they arrive, not coming out of their car, and when we are ready, we'll have the MA bring them to the back of the office, into the back door, and immediately room them into that special room, so they're not coming in contact with uninfected people and potentially having that exposure risk.
Great.
Did I miss anything?
Very thorough. Thank you. Who is a vulnerable individual as defined by the White House guidelines?
So CDC, White House guidelines, they're mostly saying are elderly, so anybody age over 65, anybody who has comorbidities, so multiple chronic health conditions like diabetes, hypertension, any type of respiratory diseases, so COPD, asthma, any of those, blood pressure issues, anybody who's immune compromised. So I kind of include that as anybody with autoimmune conditions, anybody who has some type of immunodeficiency, or is receiving any type of biologics or immune modulators or like chemotherapy treatments. Children, I don't think are considered in the high risk category right now, but that's ever changing. Typically like in a flu virus, in a flu season, we always say our elderly and are very, very young. This has been a little bit opposite of that. Additional was anybody who's kind of that fits under that category of cardiometabolic risk factors. So if they have a lot of inflammation and inflammatory markers in their blood work, so elevated CRP, if they have that insulin resistance, hyperglycemia, if their blood sugars are typically over 100, that signals to us that there is generalized inflammation, which makes your body more susceptible to then not being able to fight off any other infections.
Okay. Can you speak a little bit to the CDC projections on how this is going to play out?
Yeah, so the CDC, sorry, I'm pulling it up because it was a large graph. On the CDC website, you can actually go to trends, and then you can actually click on your state and national. All of them overall, you see this spike kind of going upwards, which we've known. They've been talking about that. That hasn't really been, that isn't new information. Multiple different research models are included in the CDC's projections. Some are including the original social distancing guidelines, which were supposed to remain in effect when they were doing the original projections until June. And then some of them are their projections are showing with a decreased guidelines. So as we're trying to return to our new normals, so you can see that regardless of how relaxed guidelines are or how strict, we are going to start seeing that spike up.
Okay. Let's talk about a few of the best practices coming out from the Washington projections. If you can speak to the ongoing habits that we should employ in public, at schools, in workplaces.
So for the most part, if you're considered a high risk or a vulnerable individual, you should still try to shelter in place. You should still, wash hands frequently. We should all be avoiding touching our face. Obviously, if we are having any type of upper respiratory cough, runny nose, watery eyes, sneeze, fatigue, fever, the GI symptoms that they've talked about, we should stay home, contact our healthcare providers, and find out what our next steps should be. Finding out if anybody that you're going to be coming in contact, so if it's going to work, what their protocols are, people can do that. Wearing face masks, the cloth face masks for non-medical, if you're going out to the grocery store. Trying to limit any gatherings to less than 10 people. And even then, I still tell people, if you can kind of keep that 6 feet distance in between each other, that's just better for everybody. Then minimizing non-essential travel, which we already kind of talked about. Schools, they're currently closed, and it's going to be summer, so they're, I know, in the process of looking into what is their new normal going to be. I have a feeling it's going to be a lot different than what we typically have seen. I don't know if they're going to be making smaller classroom sizes. I know some schools are offering, I think, some summer camps for a limited number of students in the Valley. And they've mentioned that they're going to be having smaller, almost like little pods of kids that are separated, throughout the day. I have a feeling they won't be doing very many field trips. There's probably going to be a lot more hand sanitizer and hand washing and learning how to, line up on the certain dots, outside on the playground to try to teach them about that 6 feet distance as much as possible. Senior living facilities, hospitals, hospital guidelines, they are kind of currently dictating what their visitation policies are. I would expect that if they haven't been, and they will be probably taking temperatures, when people are coming in, wearing masks. Since our seniors are high risk, if we can limit their exposure, that's the safest for them. So, if it's the ability to be able to sit outside and from a distance and visit our loved ones, that might be okay. But again, some of the senior facilities might have strict visitation protocols, especially since they are being some of the hardest hit right now. Large venues, as far as I'm aware, I think all concerts and large events have been canceled through the year, I thought. So I know for the most part, those are not too much of a factor at this moment. I have no idea how that will work out in the future. How do we, after, December, how do we maintain at a concert or a show of any type that distancing, whether they're going to be blocking off rows. I think as consumers, that's something that we should ask when we are scheduling or buying tickets for the future, is what are they doing to help to decrease the spread as much as possible, especially because most of these are going to be in large groups greater than 10. Elective surgeries, those are set and are able to resume, I think this week in Arizona, as long as they can fill out an attestation form through the Department of Health, and that I believe was saying that they have adequate PPE, they're not running on a shortage, they're able to test themselves, I think, in individuals for the surgeries, that they have proper cleaning supply and no shortages, and they have an adequate supply that they are getting in. I believe most are looking into that. Not all of them have opened because, as well, they too are running into the supply and demand aspect. But the ones that are able to properly meet the current guidelines, and those guidelines are on, I know, the Arizona Department of Health and Human Services, I think the Maricopa County Department of Health, so you can see what Arizona specific guidelines are as far as elective surgeries being able to be held now. Gyms, bars, those currently I think are remaining closed. Gyms, they have to be able to do the strict physical distancing and the similar sanitation protocols. You know, for some of them, I've seen some articles, you know, on how they're cleaning. I think for people, we just need to make sure, do we need to bring our own little bottle of hand sanitizer as well, just in between equipment, you know, just putting that on. It's hard because if people are sweating, to make sure that they're not wiping their face, you know, and then with the towel and then putting it on one of the machines and then picking up and wiping their face again, because ultimately you could be self-contaminating at that point. You know, we get blessed with a nice weather here other than the summertime. You know, so we've had the ability to exercise through biking, walking, hiking. You know, if you have home weights or home, I know a lot of the fitness experts have been posting YouTube videos or on social media and just doing kind of their civil volunteering of, you know, providing free workouts so people can follow along.
I just wanted to add to that our own Jody Stokes has been recording a plethora of videos, and they're posted on our webpage, on our Facebook page, and they're fantastic. She's upbeat, she's engaging, it's fun to watch, and she does everything using parks and benches and things that are accessible to everybody. So that's a resource you can go to.
Okay, so we had some questions come in. One of them was the testing availability at Lifescape. We have had a limited supply of the PCR, so the nasal swabs. I think our supply has been a little bit more regular coming in. I always tell my patients that if I wanted to get them tested, I'm always checking to make sure, do we have the test kits, how many do we have, and then scheduling for those patients to come in at a specific, or come to the office at a specific time, and setting that up with the medical assistants. I'm hoping that as we're getting, you know, the national pressure to be able to get this testing ramped up, it'll be more available to individual offices. In our office, I know Arizona is currently having, and Phoenix is having their testing blitz. The Department of Health is doing their testing blitz for, I think it's the next 2 Saturdays, because they did one last Saturday. Their goal was to aim to get 10,000 to 20,000 people tested a day. So I know you can go on to their websites, and even the local news has links to it as well. Most of those places you have to pre-register. It's drive-through, so people don't have to wait for hours and hours and hours, but they do want people to schedule that. We've been using and we have availability for the Vibrant serology to look at the antibody testing. We don't have a short supply of that I'm aware of. I always, again, you know, my rule of thumb is you call the office if you're interested in it. We can set you up for an appointment with that and find out if we have enough test kits in the office for the day, or if we have to schedule for the next day. But we've been getting pretty regular shipments of that into the office.
Can you address the co-condition of diabetes and potential COVID infection, and how risky that is for that person, and if that does happen, what should they do?
So diabetics in general, they're at a higher risk for infection. That higher blood sugar causes that inflammation in the body, and our little microbes love to feed off of sugar. So if we have high blood sugars, you're like a petri dish, kind of. Not truly, but you have that morbidity, and you have your body has a harder time fighting off infections. So the risk factors, for them can be multiple, because it's harder if you do get sick, if you do have to go into the hospital, it is harder to get off of the ventilators. It is harder to get off of those blood pressure medications to help stabilize people. People who are sick and laying in bed, especially diabetics, they're at a higher risk for getting the bed sores or the pressure wounds, and that those have a harder time of healing. So you're just providing another way to get an opportunistic infection. The best thing to do would be to minimize those risk factors, is start to work on the blood sugar and regulating that, and that's through our wonderful Dana. She does marvelous work with that. People aren't on strict, horrible diets. I always joke, she comes here with this huge bowl of vegetables and this amazing looking food. You're never hungry with her. But really re-regulating and getting that excessive sugars levelized down, improving physical activity, minimizing any issues with being overweight, all helps your body to be able to fight off things as it normally would in a healthy individual.
Can I contact my LifeScape provider without visiting the office?
So we offer, and we have been for probably over a year, we do the telemedicine, so the virtual kind of video visits. We also do telephone consults, telephone visits with patients, especially if they don't have the ability to get or don't have internet connection, or laptops or phones with the videos on that. The concierge doctors here, Dr. Wilder, Dr. Stroman, Dr. Posen, and Dr. McMillan, their patients have the ability to contact them directly. So whether it's email, text, Skype, FaceTime, any of those means they can contact them. But yes, we're working more than ever to make it easy for patients to be seen, whether it's via phone, video, or for those that do want to come into the office or have to come into the office, we're able to do that and work with them.
Can you talk a little bit about our LifeScape aesthetics?
So Noelle and Charity are doing virtual visits and virtual consults for patients. They're trying to work on scheduling anybody who wants any of our aesthetic services outside of the office hours, and making sure that they're not having to wait in the waiting room. They can notify them, the patients can call when they get here, and then they can bring them immediately back. They're wearing their face masks, disinfecting regularly and in between every patient. And most aesthetic services in general, they had to do that beforehand for a lot of procedures. Now they're just making sure that they're diligently, doing it up to the code and then some. And Noelle provides, whatever her recommendations are. We have some of our specials. What was the recent special? You could pick up, was it Get Your Glow On? I forgot about this. I'm so bad. I'm like, I forgot. But she's offering, whether it's skincare, she can make the recommendations, and then they can, I think they were doing delivery service.
Home kits that you can use on your own to follow through with the recommendations.
So we're trying to help out, our patients as, in any way that we can, whether it's delivering, skincare, toilet paper.
Groceries.
We're here to help, and we want to make sure that nobody's struggling.
I'd like to add on that grocery side that the North Scottsdale Farmers Market is open on Saturdays between 9 and 11. If you go to their website, they will prepare a box for you of select vegetables each week that you can pay for in advance online and then drive by the market and pick up your box. They also have add-on ability, so you can put additional vegetables in there if you like. I'm getting mine tomorrow. I'm so excited. It's the biggest event of my couple months.
She's like,
is driving to the farmer's market to get my box. But they have some fantastic vendors there that can also add to your box if you want. So everything can be done virtually, and then just a quick drive-by and pick up. So that's another option for our patients who live more on this side of town.
So we've got a question of, tell us about what's happening in your own lives. Well, I have now become a first grade teacher and a fifth grade teacher. My teachers lied to me. My children aren't always a pleasure to work with a class. I've had to relearn some basic math concepts and Google which ones I don't know to try to teach. It's definitely been different because I'm used to seeing everybody in the office, and now, everybody's on different schedules and skeleton crew. It gets kind of lonely, but so it's always like exciting on my office day because I'm like, oh, I get to see people. I've never been so excited to go to a grocery store to like quick pick up something, because I'm like, ooh, people, I see people. But it's been just taking walks every day outside, which I've noticed more and more, at least in my neighborhood, more and more people out walking that I've never seen before in my life. So, and everybody's friendly. So, everybody's just craving, some type of social interaction because they're like, hi, from across the street. How about you?
Same as Valere. I'm super excited to do my cooking classes, to come in and work with an office, a real official office instead of a home office.
And though your dog will be very upset with you. Your fur baby will be mad.
I have a fur baby, and he's very, very smart. He's an Australian Shepherd. And so now he's learned which clothes mean that we're going to the park to exercise versus which clothes means I'm going to take my 2-week trip to the grocery store. And he's becoming very attached to watching me sweat in the park.
We might have to bring him in the office sometime. We might have to ease him into when we all start returning back to work.
He's fantastic. Yeah. I too have noticed more people walking, biking, scootering in the neighborhood, and I have seen people there. I've lived there for some time I've never seen before. So I'm sure they've lived there a long time as well, but families are out every single night doing something. One particular family I have to call out, they are so fantastic. It's a mom, dad, and 2 adorable little daughters. And every night they're out doing something else. The dad has the roller blades, and they all have the pads on their elbows and their knees.
At least they're doing that.
Yeah.
Mine aren't. I'm getting cuts and bruises and first aid care every day. I feel like.
So it is nice to see the community enjoying the outdoors and each other within family units.
Yeah.
Definitely. What do you think some of the long-term expectations are from this pandemic?
I think, this isn't a short term. I think we're going to be in this for a while. I mean, I hear 12 to 18 months. I hear a couple years. I think just depending on what researchers and which science community and everything we're looking at. I think kind of some of the new normals are going to be like the social distancing, face masks, that's more common practice. And, even on flights now, I hear that they're doing it and going to be checking temperatures. So I think it is going to be different than what we're used to, which is hard because for those of us that kind of like routine and like to know what's happening all the time, like me, I'm kind of like, okay, I don't really know. I just have to know that this is for right now, and I can't think about the other part necessarily because it could change again. But to staying positive, I think is the biggest thing to try to do, and try to find some of the silver linings, like seeing more of our neighbors, and getting to know them, whether or not you know their first name, but even just that visual recognition of them and kind of, holding up a hand or smiling at them and saying hi. Definitely I do the meditation, whether I get a full 20 minutes sometimes or 5 minutes with a tapping on my forehead with questions. That's been my zen to try to be like, okay, I can do this. Watching, your favorite TV shows. What are things you like to do that help keep you positive?
One of the things I've started doing is waking up, and before anything else happens, I don't grab my phone and check the news. I pet my dog, and I tell him how amazing he is, and he gives me that back. And then I say 3 things I'm grateful for, and I really mean it. And when I'm done doing that, then I get up and start the day. But starting the day with a gratitude practice is really, really helpful. Another thing that I like to do is I go out into nature. I do have a dog, so that helps encourage that. But we walk quite slowly. He's 13 and a half, so he has the pace of a slower dog.
He's not trying to run the marathon.
He's not, and he reminds me to slow down, and I'm noticing every single aspect of nature and wondering, in wonderment at how incredible it is. It just keeps going on its own time frame. And I breathe all that in, the smells, the sounds. I see people walking, I wave 6 feet away. Those kinds of really simple connecting, grounding down to the earth can do wonders for you when stress hits.
And I think staying socially connected with family, friends, loved ones, coworkers. So whether that's video calls, telephone calls, writing letters. I've started making my kids write little notes, to their great grandma, just to help, stay connected to people. But as well, I think it's also that kind of giving back, because if you get a letter or a telephone call from somebody, it makes you feel, nice, because somebody else could be having a good day. So you just taking even those few minutes to say, hey, how are you doing? Do you need anything? We feel good, but it also makes that person that maybe they were having a rough day, it makes them feel better because they realize that somebody cares about them or somebody's thinking about them.
Yeah, and speaking to that point of helping others, one of the things I said to myself the other day is, I am so grateful to be of service. And I have always had that attitude, which is why I'm in the health professions. And I can tell you, and any of my patients that are watching, I'm so grateful to all of you for coming around and really caring about your health and the health of your loved ones, and stepping forward in this really difficult time to make these changes and address longstanding or new health problems. But the act of being in service, as Valerie said, is essential during this time. It takes you out of your own way.
Mm-hmm. And in here at Lifescape, like we had kind of previously touched upon, we're here for, our community, our patients. We want to be able to help in any ways that we can. So, like we said, whether we need to try and get you some toilet paper and drop that off to you, groceries, somebody to talk to, whatever it could be, just, reaching out, because we'll do whatever we, possibly can, to help people out.
Absolutely. I know that's true for all of the staff, from top to bottom. Every single person here is doing above and beyond to help, and we'll continue to do that for all of you. Just let us know what you need, and we'll be there.
Yeah.
I think this concludes our Friday Facebook Live.
Thank you, Dana, for coming
Thank
to
you.
help me,
Thank
because
you,
I have
Valerie.
stage fright, so even in front of a camera, I'm like, oh, what do I do?
Yeah, so this hopefully there's some pearls for you to take away from this discussion, and we look forward to your communications as always. If there's anything you need, reach out and let us know. We'll do our best to accommodate. Until then,
Happy
be
Friday.
well. Be well. Thank you.